This is I Own the Community, and I'm your host, Sean Anthony. Joining me up next is the CEO of ADAMH, Alcohol, Drug, and Mental Health Board of Franklin County, Miss Erika Clark-Jones. And joined by her is the Vice President of ADAMH as well, Dr. Ameena Kemavor. Welcome to both of you to I Own the Community. How are you?
Excellent. Thank you. Thanks for having us.
Good to have you both. It's my pleasure. Ms. Jones, let's start with you. For those in our audience that may not be familiar with ADAMH, can you briefly share its role in the community?
Absolutely. And can I just say thank you for choosing us to be on your show. It's really important that we talk about all aspects of health, including our behavioral health and our behavioral health wellness, as well as our mental health wellness. And so it's great that we have time on your show. And your ADAMH, the Franklin County ADAMH, Alcohol, Drug, and Mental Health Board, is one of 50 boards across Ohio. So every county has an ADAMH board that represents them. And what that means is essentially a governing body that is looking out for the funding, the planning, and the evaluation of behavioral health services. So that includes services related to addiction, but it also includes services related to our mental well-being. And it's awesome to be able to occupy this role for Franklin County, because a lot of times we're looking out for folks that are almost the most marginalized or don't know exactly where to turn. And your ADAMH board really steps up, leans in, and makes sure there are services for every resident in Franklin County. So I can tell you that we're levy funded. And that means the taxpayers support this type of investment in our own community. I will tell you, while most people don't know of ADAMH specifically, they know us by the people we fund. We fund Southeast Behavioral Health Care, Maryhaven, NetCare, Concord Behavioral Health Services, North Community, all of these familiar names. Actually, more than 33 agencies are who we fund throughout the community, ranging north, east, south, and west throughout the county.
Now, Ms. Erika Jones, you became the CEO of ADAMH back in January of 2020, right before the pandemic, which is probably one of the most challenging times anyone can take over a leadership position in this country. My question is, what has been the focus over the past 2 years?
Oh, that's a great question. And thanks for calling that out. Let me first say this. We think the pandemic was clarifying. We all knew there were challenges in our community prior to the pandemic. And let me say, the pandemic is not yet over. And so I want to be mindful about that, as we know the virus is still out there and we want people to protect themselves. But one of the key things that we focused on, Sean, is keeping the doors open. We wanted to make sure none of the agencies that we funded had to close their doors and were available to anyone that they needed, that needed them. So we wanted to make sure the funding didn't stop and that providers had what they need to be able to see people day and night, even on the weekends, to be able to meet the needs of folks living in our community. And one way that happened was to be able to make sure they could see patients remotely if they had to. So that means telehealth or seeing folks over the phone, by phone, over the phone, virtual meetings, you name it, really making sure they were accessible. And so that was item number one. Number two was about funding. We went to the Franklin County voters in November of that same year, right as we were all learning about this pandemic, to say, don't let your behavioral health network go dark now. And so the voters overwhelmingly passed a levy for increased funding needs here in our community during the pandemic. So we kept the doors open, we kept services available, we got more funding with the support of the Franklin County voters. And then we went to the people and we said, how is this working for you? Can you tell us more about our network? Tell us what we don't know. And over 2,000 folks responded and said, while we love the players that we know and the agencies that we know, here's what we think we need more of. We need more access. Families need to understand how to navigate our behavioral health system. Individuals need to understand how to navigate it. We also learned there is a significant shortage in our workforce. And they told us loud and clear, create a pipeline where people who want to work in their community in this way at these agencies, How do they get involved? How do we support our current students to become future professionals? And so that message was also not lost on us. And then lastly, again, from that community survey, our board of trustees, we looked over and analyzed all the information that we got back from community members, and we set our sights on priorities for the next 5 years. And number one on our list, our whole mission is to improve equitable access to care. So that's anybody, no matter what your circumstance is, no matter what your income is, no matter what your zip code is. We want to make sure you can get in to a service provider and a professional when you need them. And so we're working on that right now. And I feel very strongly about these priorities.
Can we dive a little bit deeper, Miss Erika Clark-Jones from ADAMH, CEO here, if you're just tuning in. From that strategic plan you mentioned, what are some of ADAMH's biggest priorities other than the one you mentioned?
Yeah, thank you for that. And because that's really important, right? So a lot of things emerge from those, from that survey to the community, and where they said, this is what we need. But we chose a couple of areas to focus on. And the first thing is what we call the crisis continuum. But to anyone listening, it's what do you do when you have a crisis, or a loved one, or a friend, or family member, or a colleague has a crisis? And so one of the most visible priorities we have is enhancing this crisis continuum of care. So what does that mean? We want to meet people where they are with services that they can access. So this summer, essentially, I'll frame it this way, Sean. We want there to be a place to call when someone has a crisis, someone to respond or to come in the event an individual is in crisis, and ultimately, if need be, have somewhere to go if you're having a behavioral health crisis. So we're very fortunate that right now we have a relationship with police and fire here in Franklin County, notably with Columbus and some other jurisdictions, Reynoldsburg and other places. When you call and law enforcement needs to respond, they are now showing up with a social worker or a licensed professional that can help bridge the gap with additional services that are needed. After that safety issue has been addressed, how are we addressing the behavioral health needs of the person? And so that relationship has evolved, and it continues to evolve. And that's one way to think about crisis. But what happens when you don't need a public safety official? What happens if all you need is a clinician or a peer to come out and respond to something that's happening in the house and you just need some extra support? Well, that's what we're investing in even this year. So that is, we call them our mobile response teams, that once you make a phone call and say, we need this kind of support, we have a group of licensed professionals, not including law enforcement, that come out and respond to your concern. But let me say this, when it comes to the number to call, in July 15th, actually, with the support of the state of Ohio, Mental Health and Addiction Services, 988 will be coming to our region. So it's a great time to talk to you, Sean, because in just a few short months, you may dial 988 when you have a behavioral health, mental health crisis, or addiction-related issue, or someone you know is in crisis, and call that number. They can address the concerns over the phone. They can deploy a team to come out and see about you that does not involve law enforcement, as long as it's not a public safety emergency. And then in 2024, we hope to be able to bring you to a place that feels warm, welcoming, comforting, and that can stabilize an individual in crisis. And that's our Franklin County Mental Health and Addiction Crisis Center. So that's the big thing for us. Someone to call, somewhere to call, someone to come, and then somewhere to go if you need to. And that's what ADAMH is investing in.
That is awesome, Miss Erika Clark-Jones. You say in July 15th, we're going to get the number 988. It's going to be accessible to everyone publicly in Ohio, in the entire state, right?
That is correct, Sean.
That's exciting news, because
I know, right?
You've heard all the stuff that we go through, communities go through throughout the country dealing with mental health issues. And the first thing people, know to call is 911, and then it just escalates. But I'll digress. But let's switch gears there a little bit and tie this in to mental health. I'm sorry, go ahead, Ms. Jones.
I was just gonna say one more thing when it comes to our priorities. And Sean, I mean, the work that you do in your station and underscores the need that we stay in touch. We stay in touch with our community. We never lose sight of who we're fighting for. That's one of the things that gets me up every single morning. And one of the changes I was able to make as soon as I came on as CEO was to think about how we engage and advocate differently. And so we were blessed to have Dr. Kevin Dixon be at the ADAMH board for over 30 years. And when he departed, he left a hole that it took more than one person to fill. However, we did find someone who we think is pretty darn close. Not only that, she's a rock star. She has a significant set of experience, over 27 years in the field. She's a licensed professional clinical counselor. And I'm so happy to call her our Vice President of Advocacy and Engagement. We put together a really strong team led by Dr. Ameena Kemavor. That's who I'm speaking about. And I'm glad, Sean, that she's joined me today. But when you asked me about my priorities, that was another priority. How do we strengthen our advocacy and engagement team? And I was really thrilled that Dr. Kemavor stepped up to be a leader in this space.
What an amazing introduction, Ms. Jones. You want to take my job and do what I do? That was an amazing introduction. Dr. Ameena Kemavor, welcome to the platform. I want to bring you in on the conversation, Dr. Ameena. We're hearing a lot about the rise in mental health issues since the pandemic. And of course, we kind of just, spoke on it briefly. Can you share some of the concerns you're hearing about, when you're out in the community?
Yeah, absolutely. So it's important for us to really kind of just acknowledge, if you will, that the conversation around mental health has changed during the course of this yet ongoing pandemic. So in my experience, prior to the pandemic, mental health was really not that broadly recognized as part of what I like to call everyone's business, because it is, it impacts all of us. And now the language, I guess, then was more connected to if someone actually had a diagnosed mental illness, then we would talk about mental health, right? But now, since the pandemic, mental health is being far more widely acknowledged in collaboration with physical health, right? Symptoms, when you go to your primary care physician, athletes are talking about the importance of mental health, actors, community leaders, now even more personally, just in our own family and friend units. So I feel like this is a great start as we reflect on what that looks like to our community, but we are still very much, unfortunately, steeped in stigma. And stigma is still associated with mental illness, especially in the African-American community. It's a barrier due to the historic distrust of the healthcare system. And unfortunately, this also means that communities of color are really just not accessing mental health care that they need at the same rate as other people in the community. And so, for example, the National Alliance on Mental Illness, also known as NAMI and AMI, shared that 1 in 3 African Americans who need mental health care actually receive it, 1 in 3. So part of not really receiving care is because some of us are just conditioned to keep going. Some of us are raised that way. We've been raised that it's okay that if you're not okay, but it's actually not. So seeing your inability, if you will, to keep going is then seen as this sign of weakness, instead of a possible actual mental health system that could be underlying and kind of perking up a little bit. And so some of those signs I'm going to share, which I can't be a clinician, not share a couple of those with the audience, is that if you are feeling more tired now than usual, if maybe you're having simple things like just difficulty concentrating, not remembering, some daily tasks that you're engaged in on a regular basis, maybe increased or excessive fear or worry about really anything. It could be anything. So not any one particular thing. And then also, most importantly, if you're withdrawing from family or friends, these are all, any one of these is a reason to be able to reach out. So you can also learn about more of these signs and symptoms as a community, your listeners can, just to give us a little bit of insight, if you will, as it relates to whether or not we may have a mental health concern going on. NAMI.org is also a really great resource to plug into. And then locally, because we have all this really great stuff that's happening, as our CEO already explained. Right now, if you want to just pick up the phone and connect with someone directly, you can call 614-276-CARE, and a licensed clinician will be there for you to respond. But overall, as a community, I feel like the African American community is very resilient. I'm very hopeful in this space. I'm very appreciative of the visionary leadership of our CEO because ADAMH really is focused on engagement. And that also looks like increasing access, as it was shared, to mental health and addiction services through all the variety of linkages that Erika shared, developing this workforce that is diverse across racial and ethnic backgrounds. And then also educating our communities as a whole so that we can continue just to reduce that overall stigma. So there's a lot of work to do, but we are up for the task. I'm excited to be a part of it. And we have a really dynamic group of leaders, which is everyone here at the ADAMH board.
Dr. K, before we conclude, what is one thing that maybe you could share with our listeners that you do to take care of your own mental health?
So during the pandemic, we all had to adjust. There were times I love to cook, but I mean, it might not be safe to go to the store right now because of this and that, and the hours are changing and things like that. So I found that just dancing around my house is an easily accessible way for me to take care of my own self-care. It involves no one else unless they want to join me, but just kind of helps to release a little energy, helps me to decompress and just really feel better overall.
That's awesome. Ms. Jones, did you want to add anything?
Oh, sure. I love that. And you can see why we're thrilled to have Dr. K on our staff and our team. Not only is she a motivator for the community, she's a motivator for the folks here at ADAMH, and just can't be more pleased to have her join us. As for me, what I did during the pandemic and continue to do, which I think is really, really great, I took advantage of our community's metro parks, kind of an untapped jewel. I think one day I said, look, I got to get out of this house, but I can't be near people. You know, I need to blast my music without having my kid try to outblast me with his music. So I put on my headphones. I went out to High Banks, and they have an amazing trail. Like they're, you know, the different lengths, 1.9, 2.4, 2.8 miles. And I enjoyed it so much. At one point I took off my headphones and just took it all in. And I just started doing that every week. Then I started saying, well, heck, there's like 20 other more parks that I got to get to. And so now my husband and I, we go out to different parks every month, see what's out there. We've encountered lots of travelers out there on the trail too, but it's wonderful. It gets us connected to something bigger, helps us remember our purpose, remember each other, and gets us just a little more headspace so that we can, you know, go back home and start all over again. But it's been absolutely incredible. And maybe I've lost an inch or two off my waistline. I don't know. I'm hoping.
Excellent. Well, ladies, it was my pleasure to have you both on the platform. I thank you for your time. I want to, once again, ladies and gentlemen, we want to thank the CEO of ADAMH, which is the Alcohol, Drug, and Mental Health Board of Franklin County, Miss Erika Clark-Jones, and the Vice President, Dr. Ameena Kemavor. You ladies have a wonderful week. And again, thank you so much.
Sean, thank you.
My pleasure.
Thank you.